Hi, my name is Lily, and today I'll be demonstrating how to do the Hawkins-Kennedy test. This is a test that's testing for subacromial impingement syndrome, and this is the most common cause of shoulder pain. It accounts for about 45 to 56% of shoulder disorders. Some common signs and symptoms include pain in the shoulder, arm, or neck, and pain can be consistent and increase with reaching or lifting movements. Patients will often demonstrate a limited range of motion or muscle weakness, and it's also very common to see joint stiffness or tenderness in the shoulder. Subacromial impingement syndrome is thought to happen due to a couple reasons. One of them is compression of the rotator cuff between the humeral head and the inferior acromion and the coracoacromial ligaments. Another reason is degeneration of the supraspinatus, so attrition or weakening of the supraspinatus can lead to instability of the glenohumeral joint, which can cause a narrowing of the subacromial space and cause pain. Inter-rater reliability of the Hawkins-Kennedy test has found to be 0.38 or 38%. Sensitivity is kind of variable. Research presents a range of about 0.62 to 0.92 or 62% to 92%, and specificity has found to be a range of 0.25 to 1, so 25% to 100%. And because the reliability, sensitivity, and specificity are so variable, other diagnostic tests should also be performed as well. Some other tests that can be performed are the NEAR test, horizontal adduction test, painful arc test, drop arm test, and the Yergeson test. So to do the Hawkins-Kennedy test, the patient should be sitting or standing. I'll be doing this in the standing form because that's what's easiest. And the shoulder, elbow, and wrist are in anatomical position. The examiner position should be lateral or anterior to the affected side. I'm going to be lateral, and one arm should be hooking under, and then crossing and supporting the affected arm. And the procedure is to create 90 degrees of flexion at the shoulder, and then flex the elbow 90 degrees inward, and once here, you internally rotate the humerus like so. A positive test will produce pain in the shoulder, especially at the range of motion. Implications for this: pathology is present in the rotator cuff, especially at the supraspinatus, and the long head of the biceps brachii tendon has also been implicated. The motion of the test impinges these structures and between the greater tuberosity and the inferior side of the acromion process, and that's where the pain is produced. Some modifications for this test: the patient can be seated or standing. As I already mentioned, I performed this in the standing position, but it can also be done seated if the patient so desires. And the examiner position can also be modified with the hand placement. And just some general comments: if the humerus is moved towards the sagittal plane, so if the arm is moved outward like this during the test, the probability of a false positive result increases. So you should really make sure that the patient's arm is flexing and not abducting during the test. This is another angle to show how to perform the Hawkins-Kennedy test. So remember to elevate the arm into 90 degrees of shoulder flexion, 90 degrees of elbow flexion, support the arm with one hand, and then internally rotate the humerus like so. And as already mentioned, a positive sign will be pain at the shoulder with internal rotation.